Thank you, Niriha, for meeting with me today. I think that this is going to be a very important video that I, as the Director of Clinical Services for our patients, is just so you're aware, my name's Colette. I do run some of our patient education programs here at PRINE Health. We do try to give our patients all of their options early enough before they absolutely need dialysis, just so that they know a little bit more of what options are out there and what they can expect. So that's where, you're coming into play here. I wanted to get your personal experience about just going through the motions of your kidney disease. At what point you came to see Dr. Tepedino here, and how you felt a little bit about your different options and what led you to choosing to be on peritoneal dialysis today.
Okay, sure.
So if you could tell me a little bit of, when you got your kidney disease and, how long your timeline was and everything like that.
Well, I was I was diagnosed with lupus at 18. I was in college. I went to donate blood, and I had the classic butterfly pattern on my face. And at that time, not much was known about lupus at all. And the doctor sent me for some blood tests, and they found out that I had lupus. And then shortly thereafter, they also discovered that there was kidney involvement. So I had what's called lupus nephritis. And, but I, I mean, I did have some hospitalizations with lupus, but never for kidney per se, lupus flare-ups. But I'm 76 now, and I managed to, during this time, travel to more than 70 countries. So my point is that lupus and kidney disease doesn't have to completely sideline you.
Right.
You can.
Yeah, it's not a such a terrible thing to live with if you're able to manage it. That's what you're saying. You're able to go and do things that you enjoy and like to do. So that's really good to hear. Okay.
And of course, I was younger, but now
Yeah,
I'm older. It's affected me a little more.
I'm sure. I'm sure. Well, you came to that point, I guess, when you started seeing Dr. Tepedino. Now, just tell me a little bit of where you were at once you started following up with him. Um, do you remember what stage you were in?
Yes, when I started with Dr. Tepedino, my I was already stage 5,
Okay.
and yeah, my GFR was about 14.
Oh, wow. Okay. And then from your first visit with him, how long did it take for you to need to start dialysis?
Um, about a year. He was very concerned because I had constant high potassium, which
Right.
can be dangerous. It does affect the heart, can even make the heart stop, so you can't play around with it.
Yeah.
And I had such consistently high potassium. He said, you really do need to start dialysis, even though my GFR was still at around 12 or 10.
Right.
That is about 10 was, and I resisted for about a year. He actually tolerated me for about a year, not really following his advice. So it did take me about a year to finally acquiesce. But during that time, I did do some research, and I said, well, I'm going to have to do dialysis. I wonder if I, want to do hemodialysis or peritoneal dialysis. The difference being that the hemodialysis would require going into a center probably 3 times a week. And peritoneal dialysis, I knew I would do at home, but would require my attention like every single night I'd have to do it. So I had to weigh the options. But I felt that the freedom that I would get from doing peritoneal, plus I felt that it was a little gentler because you're not pulling your blood out of your body. I read that people who were doing hemodialysis would feel quite poorly the day after. But then the following day, they'd start to feel good, but it was time to go back and sit in the chair again
Right.
and have their blood drained, have their blood purified again. So basically, their story was they never really did feel that good. So I was figuring it on peritoneal dialysis, I would probably feel better overall.
Mm-hmm. Okay. Yeah, I mean, that's definitely a good thing you took the time to educate yourself, right? And look into it. Were there any specific websites or sources that you found to be more helpful, or were you just like on Google looking things up?
I just did the Google thing and
Gotcha.
I mean, I'd go to Mayo Clinic. I would go to known
Okay, good.
health clinics because the internet can be full of misinformation.
Exactly. Yeah.
So I would go to I remember I went to Mayo Clinic site.
Mhm.
There's a national kidney site.
Yep.
And I check things out there. Um,
All right. Those are all great resources. Now,
I
when
also spoke to Dr. Tippett.
yeah, I was just getting to this to that. So
What his opinion was.
right, because
And he thought I'd do really well on peritoneal dialysis because he felt that I was capable of, setting up the machine.
yeah, right. That's important. And the drive to want to do that too and to take kind of the charge of your healthcare at home is very important, I think, in this, type of dialysis that you're doing. So another thing that I wanted to ask you about was what did you expect other than um, having more freedom with PD than compared to hemodialysis?
I thought that I would feel like much better because I was was at the point with the kidney disease where I was noticing it was really affecting my energy. So I was expecting, I said, well, I think I'll probably feel better because you're doing it every night for 8 hours, like while you sleep. And that's a little more like what the kidney does, because the kidney is cleaning your blood 24 hours.
Right.
So I said, well, at least, for 8 hours, the peritoneal would be cleaning my blood. So I'll probably feel pretty good. What I didn't figure was that because I also have anemia, I have low hemoglobin, that affects my energy greatly. And the dialysis will not correct that. I do get injections for it, but I haven't felt as good as I expected because of that.
Gonna ask. Okay.
Because of that.
But yeah, you do have the underlying anemia factor. I see. Okay. How was your experience first going into the dialysis center and meeting with your PD training?
Oh, they
team?
were wonderful. Dr. Tepedino sent me to a specific dialysis center, and the training for the PD was extremely thorough. It was not rushed at all. I think they actually, I would think once a week or maybe twice a week for about a month, and they didn't rush at all. They were extremely thorough and made sure that I knew what I was doing on my own. They even came to my house, checked out where I'd set it up to see if everything would work out for me. I mean, it was very, very caring and thorough. So I was very grateful for that.
Did you have any fears of like you would be abandoned at home without any care or just anything before you met with the team that were debunked after you met with your nurse and
No, I'm not ever worried about that.
okay. Sometimes patients get a little bit worried on, the fact that they will be on their own at home. But again, once you learn more about it, I'm sure you feel a lot more confident in just using the machine and, being cognizant of your blood pressure and your weight before and after, right? Do you have to log all those vitals for
You do your weight and blood pressure before, but you don't have to do it after. I think with hemodialysis, it's you really do have to weigh before and after. You have to do blood pressure before and after. With hemo, you really can't do it alone at home. You really, too many things can happen. Your blood pressure can plummet. I've just heard that there really has to be a nurse around at all times, a doctor, but you don't have those kinds of dangers with peritoneal dialysis. So it's a little
More rental on your body.
it's a lot more gentle body.
Yeah. I want to talk about the access that is needed for peritoneal dialysis, which is the PD catheter.
Right.
So how did that go from, I guess, your consults with the surgeon
The
and
surgeon was wonderful. I had all the confidence in the world in him. There was a little bit of a snafu. The operation went well, recovery was fine, but I had a feeling that I should stay overnight in the hospital. I didn't feel I should really go home.
okay.
But insurance dictates what the doctors do. And while the surgeon probably agreed with me, he said, well, and I have good insurance. I have Medicare, but I also have Aetna. And my plan with the United Nations was that whatever isn't covered by Medicare, Aetna covers, because the United Nations compelled its American workers to get Medicare,
Okay.
but with the understanding that we could still keep Aetna that we had with the UN, and that Aetna would cover us. And so it's been very good that way. I mean, I have complete coverage. I don't even have copays.
Mm-hmm. That's awesome.
But also, like a lot of insurance, this procedure, you're supposed to be able to go home the same day.
Yes.
So you can't really stay overnight. Well, in my case, I went home. My friend picked me up. She stayed with me overnight as they required, and I was very ill. And she said, you are going back to the hospital. And I was extremely weak. And how she got me back, I'm not sure, but she got me back to the hospital. I needed a blood transfusion. And I'm not saying this to scare people. This is highly unusual. But I think there's a lesson here. If you go into surgery with a hemoglobin low, like mine was, you might run into problems. And that's what happened. My blood pressure plummeted, my hemoglobin plummeted. I went back to the hospital. I actually need to stay, ironically, overnight 2 nights, and I needed a blood transfusion.
Mm-hmm.
And I'm very grateful that my friend insisted I go back, because I said, oh, this is just gas pain from the anesthesia. It's normal. You know, they pump you full of gas so they can get to your abdomen. And I said, it'll probably, but I was in tremendous pain and extremely weak. So she insisted on taking me back. This I don't expect the average patient to experience this at all.
Okay.
Be-
Yeah. I mean, you have your anemia that you've been dealing with for several months prior, right? So, but I think that is a good lesson to your point, to just be aware of the complications. And, I think the overall theme here is to educate yourself as much as possible, right? Because anything could happen. It's just being prepared for the outcome, or just how to handle it moving forward.
Yes.
That's a rocky start.
Yeah, it was a rocky start. So, but otherwise, I have like no issues with the port,
Okay.
except that I can't swim.
Okay.
I grew up on the ocean, and I'm sorry about that.
Mhm.
But even if I did hemodialysis, I don't think I'd be able to swim. I don't think you can.
It depends if you are able to get the access that goes underneath your skin or not. So there's an access called a fistula, that's actually put, it's your own body parts. It's not a external catheter.
Oh,
Yeah.
that's interesting.
So once all of this happened and you were home, how long were you able to resume just regular life, I guess, after the catheter, after the training, and you were home stable with your machine?
Well, after the surgery, you don't start the machine right away because it has to heal and settle in. So I think it was about a month later that I started doing PD. And in the beginning, there's a couple little things. I got cramps, but that means that you have to be careful and make sure you're hydrated. I think the cramps were more from hydration. I mean, PD does I didn't tend to have extra fluid. So,
Mhm.
the PT that I did, the fluid that went in, it would come out during the 8 hours. Like, in other words, I didn't retain any extra. But, I think the cramps were because I wasn't really drinking enough. I wasn't careful enough with water intake. So little things like that, you really have to be cognizant of. And also, the dialysis center worked with me so closely and they were so helpful. The machine will have quite a few alarms, but the nurse at the dialysis said, you're connected through Wi-Fi with the center. They can set those alarms, turn them off, lower them. Uh, eh, Basically, they can adjust things so that you're not being awakened all night long
Okay.
with the machine being unhappy with this,
Like you're,
you're
you're
straining enough,
right.
or the flow is uh, too slow. So once that got adjusted, I had no problem sleeping without being awakened by the machine.
Did they need the alarms on for a certain set of time just to see how you acclimate to the machine? Or that's just like set up like general for everybody?
I think they start out with a basic setting,
Okay.
and
Depending on how you do, they'll adjust it.
yes,
Okay. Interesting. See, I didn't know that part either.
yeah, and it's so nice that capacity with the center exists. And the
Mhm.
machine is absolutely remarkable. It's quite small, it's light. If you want to travel, you can actually put it in a carry-on and get on a plane. You get a letter from the dialysis center,
Yeah.
and it does fit in a carry-on, so they absolutely will let you bring it on. They won't try to check it.
Nice.
And
It's good.
and Baxter, which delivers the dialysis fluid, if you plan ahead, they will deliver the fluid that you need to your destination.
Nice.
Now, I don't know if they can do that overseas. I used to travel a lot to Europe and Asia, but I know if I have a lot of siblings and family in the United States all over. So I know that I haven't tried it yet,
Okay.
but I know that it's a possibility.
That's awesome.
So
Yeah, I know. The only thing I know is if you needed to set up dialysis in a different unit, it'd have to be in the United States if you have Medicare. But as far as sending supplies, that's an interesting thing to maybe look into.
yeah, yeah.
So you've definitely traveled already with your PD supplies and your machine.
I haven't tried it yet.
Okay, so you had not. All right. Do you have any plans? Like, do you have anything planned this year?
Well, I would love to, but my energy level has to get better. So now we're trying to adjust the hemoglobin, and it's beginning to stay up. Beginning to feel better.
The shots.
Consistently better.
You to feel better and you're able to travel soon. So
Thank you.
that's definitely something to look forward to.
Yes, for sure.
My
Especially for holidays.
yeah, exactly. I so busy, right? My last question for you, Niriha, I wanted to see if there's anything that you wish that you heard early on in your kidney disease, just about the different options. If you were, able to have a little bit more education up front, like, do you have any feedback on that? Or were you just more of I want to research everything myself type of person?
Well, I was happy to do my own research because I know how busy doctors are and how limited their time is with patients. And I had the feeling any questions I had, Dr. Tepedino would take all the time I needed to answer the questions. And I think that there's so much unknown when you enter into this area that until you start doing your own research, you don't even know what to ask.
True.
There's so much unknown. So you have to read about kidney. I started reading about how much diet can play a part. I think the reason that my kidneys lasted over 50 years without needing dialysis, even though I had CKD, is because of my diet. I always ate quite healthy.
Good.
I didn't eat a lot of meat. I have to be honest.
Oh, yeah, that's a
I-
big thing.
I think that when your kidneys are weak, that animal protein is very hard on them. I think it requires more work of the kidneys. And I just happen to be vegetarian all these years.
Mm-hmm.
I'm not saying that everyone has to be vegetarian, but I know that Dr. Tepedino and they're very surprised at how long
Yeah, I was too when you
from
first
the
told
time I
me.
was diagnosed until the time I had to go on dialysis.
Did you have an idea that the protein would weigh down on the kidney at all?
No, I was doing it just because, well, I'm an animal lover. I just want to be a veterinarian. Also, I had started meditation, and I felt that diet would play a big part
Yeah.
in my discipline.
Mm-hmm.
And so for like a few reasons, but now that I'm on dialysis, I have to say that I'm finding that having a little bit of, animal protein helps with the hemoglobin issue. So I'm not as strict of a vegetarian. Um, and it's actually helping my energy a lot. Um, and it doesn't have to be animal protein. It could do protein shakes, but you really have to start paying attention to protein because dialysis.
Right. So that's a good point too. So you have to start eating a little bit differently after you start dialysis, right?
Yes.
Okay.
So the thing about CKD that I found that you can't get away from is the discipline required. You really have to take charge, and you have to be an adult. And
Yep.
I like being a kid, but no, with CKD, you really have to be an adult.
Yeah.
You got to
Take care of yourself.
charge, take care of yourself,
Right.
and so.
That's great. That's good. I think that, it did work out for you just in your life and your preferences that you were able to slow the progression of your kidney
Yes.
issue,
Yes.
over time. Um, One thing and why I'm talking about this and why we're even interviewing you today is because, here at PRINE, we're really trying to educate our patients a little bit more because not everybody goes and, deals with their issues, right away or just faces it head on, and starts looking into things. So we really want to try to provide as much information and education on kidney disease, dialysis ahead of time.
I really appreciate that. Education is freedom,
Yeah, I agree. I totally agree with that. It's
and
important.
so if you really depend completely on the doctor and on, the medical field.
To just tell you what to do, right?
Yeah, and I mean, everyone is so different. And the more you know, the more you can help yourself. It's just makes a huge difference in how smoothly the whole thing goes.
Right.
The big thing is also is to have confidence.
Mm-hmm.
Don't be afraid. It is a process, whether it's dialysis at home or in a center. The main thing is just to dispense with fear and just to go and say, okay, well, this is what I have to do now, and then do it to the best of your ability and with confidence.
Great. It's really good to hear. Is there anything else that you want to share, just I guess about your current experience on PD, where you are now versus, where you were in the beginning? Anything to that nature?
Well, I had read that it was possible not to go on dialysis.
Mm.
So I was looking into all these things. I remember getting a very expensive supplement, and I'm not saying they're not true. And maybe if I had done them to the letter of the law, I might have delayed it another couple years, but I got a pretty long rough way out is the whole thing anyway. I
Yeah.
did get like over 50 years of having CKD and not having to go on dialysis. So I would just say, it does get to a point where your life will be at stake, especially if you're dealing with high potassium or extremely low hemoglobins. So don't let yourself get into a danger area because you're convinced and you've heard that it's possible to avoid dialysis.
Yeah.
And that's kind of where I stayed for a while. And Dr. Tepedino was extremely kind and tolerated my ideas until it got to the point where, he felt like I was really jeopardizing my health. And I realized too, I mean, when you start to have a potassium goes into 7,
Yeah, that's
they're
very dangerous.
this is dangerous. And so you really have to listen to the experts, even though the internet's telling you, oh, you can avoid dialysis. I mean, I was kind of playing with fire for a while, and I would caution. I mean, it's great to believe in natural medicine, which I firmly do, but you also have to realize at what point that you have to take help and accept the help that's, I think, blessingfully available.
Yeah, I mean, it's a huge life change. I think that's not an easy pill to swallow at all. So, everybody's surprised on that.
I find with peritoneal dialysis, it's not such a big life change
Mm-hmm.
because I just hook it up at night and so it doesn't take away 1 minute from my daily freedom and routine.
Awesome.
So it becomes very natural, I have to say.
So you were able to acclimate well, like now. So it's not affecting your day to day as much as, it's center dialysis would. Okay, that's great. Thank you so much for sharing your story. I think this will be very helpful.
I really wish very good luck to anyone that has to do this.
Yeah, I know we all do, but key is educating yourself, getting the support you need, right? And just having trust in your doctor and continuing that conversation with them to do what's best for you.
Yeah.
So
And I've had very positive experience with PRINE.
nice.
Extremely positive.
Glad to hear it. Glad to hear it. Yeah, Dr. Sympathy, is great. So glad you are in good hands. Thank you so much.
Thank you for helping other people who are going to deal with this because
Yeah.
it is daunting at first.
It's
It's
a lot. And, you can read a lot online and get confused, but I think having a real person experience is definitely appreciated. So I thank you so much for this.
You're so welcome.